I'm Dr. William Davis, author of the Wheat Belly and Undoctored books, and a practicing cardiologist for 25 years. So for 25 years, I did angioplasties, stent implantations, atherectomies, aborted heart attacks, took care of heart failure, all the kind of standard stuff. Until my mom died after her successful 2-vessel coronary angioplasty. I just moved to Milwaukee. She lived in New Jersey, where I grew up. And I got the phone call that she was found dead, sudden cardiac death. Well, it drove the point home to me that the conventional management of heart disease was too little, too late. Bad things happen to people. They have heart attacks, sudden cardiac death. They need procedures. So I set my sights on trying to identify heart disease early, years before heart attack could set in. And that's a whole other conversation. You'll see those conversations about CT heart scans. That's how we track heart disease and reverse it. But I call this the statin tragedy because most of my colleagues think that all cardiac disease prevention ends at a statin drug and maybe a low-fat diet. Well, we helped prove 20 years ago that a low-fat diet, aspirin, and a high dose of a statin drug does not halt the progression of atherosclerotic plaque when you track it by a CT heart scan. It does reduce heart attack and death from heart attack a little teensy-weensy bit. Not anywhere near as much as claimed by the drug industry, nor by my colleagues. When they tell you things like, oh, this statin drug reduces heart attack risk by 36%, or 44%, or 50%, they're quoting what's called a relative risk, which is a wild exaggeration. It's a marketing tool. Imagine you go to a stockbroker, and rather than telling you he can make 7% on your money, he tells you, I can make 36% on your money. You come back a year, 2, 3 later, and he's made 0.5% per year on your money. You'd be pretty mad, wouldn't you? That's what the statin drugs do, and they're dispensed like candy. But the real tragedy here is not that they're so minimally effective, it's just that the doctors think that that's all they have to do. Tell you cut the fat, cut the saturated fat, and take a statin drug and maybe aspirin. When there's a ton more you could do. So I'll be talking in future videos about all those other things you can do to dramatically reduce cardiovascular risk. But you won't know about it if you pay attention only to cholesterol numbers. You've got to go further. One of the additional steps you must take if you want to know if you're at risk for heart disease, or if you have heart disease in some form, a positive CT heart scan, had a stent, had a heart attack, or just had a family history, or you have maybe high cholesterol, you want to do an advanced lipoprotein analysis. It sounds complicated, but it's not. It's been around for decades. Cholesterol testing is woefully outdated. We should have thrown it away 30 years ago, but it's still being used because it makes a lot of money. It props up the statin drug industry. But if you really want to understand where heart disease comes from, you must do advanced lipoprotein testing, such as NMR, nuclear magnetic resonance lipoprotein testing. And all that means is they take your blood, they remove the red blood cells, they just have a clear plasma left, you put it in an NMR or an MRI device, also called MRI, and you fractionate, you separate the lipoproteins, the fat-carrying proteins, and you'll see this has nothing to do with cholesterol. Cholesterol is just one little thing in these complex lipoprotein particles. And the cholesterol in a cholesterol panel is used to crudely and indirectly quantify these complex particles. Well, for the last 20-some years, you and I have been able to characterize, count these lipoprotein particles. And when you do that, your eyes will be opened to the fact that heart disease is, to a great degree, a disease of diet and a disease of grains and sugar consumption and a few other factors like vitamin D deficiency and low-grade thyroid dysfunction. That's the basis for our programs. But I'll be talking more about that in the future. But know that the big problem with statin drugs is that if that's all you focus on, and dietary fat, you're going to lose, you've not paid attention to all the things that can be done to really dramatically reduce or even eliminate cardiovascular risk.